Good morning. This is knee examination by Dr. Hatem Galalzaki from Asyut University. We're going to discuss patellar effusion, meniscus examination, ACL examination, and collateral ligament examination. First test is the fluctuation test. The fluid collects in the suprapatellar pouch above the patella. We've outlined the patella, patellar tendon, and tibial tuberosity. We put our hands on the suprapatellar pouch, and then the other hand is put on the soft spot on both sides of the patellar tendon. We push the fluid from the suprapatellar pouch superiorly to be felt by our hand in the soft spot on both sides of the patellar tendon. The second test is the fluid shift test, and we push the fluid from the medial gutter by swiping it. It moves to the lateral gutter, and then we can push it again from the lateral gutter. It moves again to the medial gutter, and we see a slight bulge in each gutter once the fluid moves to that side. Next test is the patellar grind test, and that is to elicit pain from patellofemoral chondromalacia or osteoarthritis. The patella sits normally in the trochlea. The idea is to hold the patella with both hands and then squeeze it down into the trochlea while moving it side to side. This will elicit pain once you have any problems in the patellofemoral joint. I can also palpate the medial and lateral edges of the patella once you move it to the side. This will be tender. Meniscus examination is identifying the joint line. We put the knee in 90 degrees of flexion. We've marked out the patella, patellar tendon, and tibial tuberosity. On both sides of the patellar tendon is the soft spot. This is the beginning of the joint line. The joint line is generally parallel to the thigh in 90 degrees of flexion. So we palpate from the soft spot. We go backwards to feel the joint line by deep pressure. It's a depressed area, which will be tender if there's a pathology. Above it will be bone, below it will be bone. So again, palpating both joint line on the medial side and the lateral side at 90 degrees of flexion. The McMurray's test for meniscus examination. First, we bend the knee and identify the joint line. We start from the two soft spots. We put both the index and thumb on both joint lines at the same time. We lift the thigh towards the ceiling to make it easier. Then we hold a good grip on the foot and ankle. We rotate the heel into internal rotation while extending the knee. Then we go back to the same position, external rotation while extending the knee. And we go back to deep flexion. So it's all part of a deep arc from deep flexion and doing a half circle of extension. The idea is to feel a painful click. That's a positive test. The anterior drawer test is done by bending the knee 90 degrees. We sit on the patient's foot to stabilize the foot. We put our hands behind the knee to feel that the hamstring muscles are relaxed, and then we put our thumbs on the anterior upper part of the tibia to get the best control, and then we pull on the tibia, a firm, strong pull, slow, not too fast, not a snatch. The idea is to test for the ACL, which resists anterior translation of the tibia. The Lachman test is similar to the anterior drawer. They both test for ACL tears. The idea is to pull the tibia anterior in relation to the femur, but we do it in 30 degrees of flexion. One hand is on the outer side of the thigh, just above the patella. The right hand is on the upper side of the tibia on the medial side. We pull the tibia anterior in relation to the femur while stabilizing the femur. The pivot shift test is also for ACL tears. We want to do flexion, internal rotation, and valgus pressure at the same time to see if the knee will jerk. This can also be summarized in one movement, as if you're taking the knee, you flex it towards the opposite shoulder. This will combine the three movements together. The varus and valgus stress test for medial and lateral collateral ligament examination. We bend the knee 30 degrees because we want to relax the posterior capsule, and then we put our hand on the lateral side. We push the leg towards the outer side to do a valgus stress to test for MCL deficiency. Then we change our hands on the opposite side. We do a varus stress test. We look for lateral laxity. Be careful that the lateral ligament normally opens up to a certain degree, but it has a firm end point, while the medial does not show much movement.